Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, I want to ask you something. Have you had toothache or problem with your oral system during this pandemic? Yes, I know that it's very painful and disturbing, right? But you have ever imagined the steps to get dental treatment in this pandemic? Well, ladies and gentlemen, good morning. I am glad to be with for this nice occasion. First of all, let me introduce myself. My name is Zahra Baiti Nur Aziza. I am a student of the dental therapy program from Health Polytechnic Ministry of Health of Yogyakarta. Ladies and gentlemen, we all know this pandemic is still running since the coronavirus disease 2019 or COVID-19 outbreak was declared a pandemic on 11 March 2020. Several dental care facilities in affected countries have been completely closed or have been only providing minimal treatment for emergency cases. However, several facilities in some affected countries are still providing regular dental treatment. This can in part be a result of the lack of universal protocol or guideline regulating the dental care provision during such a pandemic. This lack of guideline can on one hand increase the nosocomial COVID-19 spread through dental health care facility, and on the other hand deprive patient in need of the required urgent dental care. Moreover, easing dental care provision during such a period will intensify the burden on hospital emergency department already struggle with the pandemic. In here, I want to tell you about how to manage patient for dental care procedure in hospital and dental practice. The goal of this information is with a patient on an operator can handle the spread of COVID-19. Well, ladies and gentlemen, whenever possible, telescreening of the patient is strongly advised. And at the first point of contact, patient should be screening for any COVID-19 symptom and any recent contact with confirmed COVID-19 patient and or recent travel to recent disease epicenter. For active and recently recovered confirmed case, dental treatment should only be considered after coordination with primary physician. When a patient arrives at the screening door of the hospital or dental practice, strict rules are to be informed and complete with. Everyone is required to wear a face mask. The body temperature more than 37,5 degrees Celsius is fever. Is recorded and history of travel, occupation, contact and cluster or TOCC is ascertained. Patients with fever and TOCC are directly taught a special passage. A visitor with the travel history of COVID-19 outbreaking area during the last 3 weeks is not allowed to enter hospital and dental practice. The dental treatment is undertaken with a focus on minimize aerosol generating practice by decreasing the use of the rotary and high-speed handle device, together with high-power suction, rubber dam application, and hand suction instead of ultrasonic cleaning. Scheduling of patient appointment during this period is limited and the next patient enters the clinic only after the previous patient has left the room and all room decontamination procedure have been completed. Each dental treatment space is separated by high wall coverage to limit the possibility in cross-contamination by aerosol in the environment, and the clinic isolation room has a single dental chair only. In this pandemic condition, dental procedures are proposed to be divided into 5 categories. First, emergency management of life-threatening conditions like uncontrolled postoperative bleeding. Second, organ conditions that can be managed with minimally invasive procedure and without aerosol generation like localized dental or periodontal abscess that can be managed without aerosol generation. Third, organ condition that need to be managed with invasive and or aerosol generating procedure like removable dental adjustment for radiation or oncology patient. And the next, no organ procedure like asymptomatic fracture or defective restoration. And then elective procedure like aesthetic dental procedure. I'd like to conclude today's presentation by underlining the information. I know that toothache and oral problems are very painful, but in this pandemic, there are so many steps when we want to get dental treatment in hospital or dental practice. Therefore, we must prevent oral and dental disease by brushing our teeth twice a day. And if we require to take dental treatment, please obey the health regulation to prevent spread of COVID-19. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.